Hello everybody. Today I am going to discuss about cholecystitis part 6 and the mechanism of cholecystitis. What is the mechanism of cholecystitis? Blockage of cystic duct by a gallstone causes a buildup of bile in the gallbladder and increased pressure within the gallbladder. Concentrated bile pressure and sometimes bacterial infection irritate and damage the gallbladder wall, causing inflammation and swelling of the gallbladder. Inflammation and swelling of the gallbladder can reduce normal blood flow to areas of the gallbladder, which can lead to cell death due to inadequate oxygen. That is the mechanism of cholecystitis. Let us see the diagnosis, how to diagnose, what are the diagnosis procedures and what are they. Now, the diagnosis of cholecystitis is suggested by the history of abdominal pain, nausea, vomiting, fever and physical examination in addition to laboratory and ultrasonographic testing. Bowel's sign, which is in the pain in the area below the right scapula, can be a symptom of acute cholecystitis. Blood tests. In someone suspected of having cholecystitis, blood tests are performed for markers of inflammation, example complete blood count, C-reactive protein, as well as bilirubin levels to assess for bile duct blockage. Complete blood count typically shows an increased white blood count 12,000 to 15,000 mcl. C-reactive protein is usually elevated, although not commonly measured. Bilirubin levels are often mildly elevated, 1 to 4 mg per dl. If bilirubin levels are more significantly elevated, alternate or additional diagnosis should be considered, such as gallstone blocking, the common bile duct zone. Less commonly, blood aminotransferases are elevated. The degree of elevation of these laboratory values may depend on the degree of inflammation of the gallbladder. Imaging. Right upper quadrant abdominal ultrasound is most commonly used to diagnose cholecystitis. Ultrasound findings suggestive of acute cholecystitis include gallstones, pericholecystic fluid, that is fluid surrounding the gallbladder, gallbladder wall thickening and wall thickness over 3 mm, dilation of the bile duct and sonographic Murphy's sign. Given its higher sensitivity, hepatic immunodiastatic acid HIDA scan can be used if ultrasound is not diagnostic. CT scan may also be used if complications such as perforation or gangrene are suspected. With this today's topic I am closing. In my next class I will explain about this, some of the diagnostic or some of the tests in my next class. Hope you all have understood. Thank you all. Have a nice day. Thank you.